How did the COVID-19 travel restrictions affect the flow of fentanyl into the US?
By reducing the number of legal travelers into the United States, the COVID-19 travel restrictions at US land border with Mexico made drug trafficking organizations switch to smuggling a lot more fentanyl compared to heroin. And this is because of the fact that fentanyl is so much more potent, about 50 times more potent than heroin. It can be supply the same market with far fewer trips across the border. And so when travel was suppressed, they needed to supply the same market with fewer trips. So they switched to the more potent drug, fentanyl, rather than what we saw with heroin. And this is really reflected in Customs and Border Protection data on seizures. It went from fentanyl being about a third of the combined heroin fentanyl seizures before the pandemic. By the end of the travel restrictions, over 90% of the seizures at ports of entry was of fentanyl, not heroin.
And then, so I guess in your opinion, did the COVID-19 pandemic almost exacerbate the entire fentanyl crisis?
Absolutely. It accelerated the switch from heroin to fentanyl as the main opioid being smuggled across the US Mexico border. And we see that reflected in the number of deaths over the 2 year period when these travel restrictions were in effect. The number of fentanyl deaths almost doubled in the United States. And that's really a tragic consequence of an unnatural shift at a really accelerated pace. Fentanyl deaths were already on the rise, but this specific policy definitely had a very important effect on the rate at which fentanyl was coming in. And unfortunately, it's a much more dangerous drug than heroin.
So, what should the US do with that information? If they take your basic premise at face value, how do you take that moving forward?
Don't restrict travel is the main lesson from this episode. Travel restrictions, cracking down on the border, these policies won't work. They will make the problem worse. We think fentanyl is the worst drug out there. This is the most potent, deadly drug. But guess what? There are other drugs that are even more potent than fentanyl, and they're coming down the pike. And that could be the next thing that comes along if we really make it impossible to get fentanyl across. Then we're going to start seeing a shift to these even more dangerous drugs, and people are going to die in even greater numbers. And that's what's already been happening. It's a long term a problem, but we need to focus on the demand side a lot more than the supply side. We're spending so much effort cracking down on the border. We're doing very little to protect the lives of drug users in the United States, help them. Basically, they don't want fentanyl. Ideally, in an ideal world, they want safe, legal narcotics. They don't want this fentanyl from Mexico. Give them the ability to screen out the fentanyl, give them test strips, give them ways to make sure they're not ingesting something that could kill them. And that's a way to reduce the demand for drugs. Because of the fact that we don't have test strips, there's no way to control the supply. It's an unregulated market. The cartels basically could make the switch from heroin to fentanyl without their consumers necessarily knowing that they were getting a different product or a polluted product. And that's really what's having these deadly consequences when people don't know what they are consuming.
Now, how do you make that pitch to lawmakers? Because essentially, you're saying make smuggling easier.
Yeah, I mean, it's unfortunate. No one wants to hear the message that the drug war isn't working, that the border enforcement isn't working, that it's making problems worse. That's the reality. my message is, well, you got to swallow the reality. No one wants to hear that the things that they've been done for the last 40 years haven't worked. It hasn't. So we need to switch back to a model that's focused on treatment and on protecting people's lives rather than just focusing on cracking down. But everyone thinks we can just seal off a 2,000-mile border and that'll be the end of it. Even if we could do that, that would just shift production to the United States. We'd have facilities here, we'd have criminal activity here, producing it locally. And so the answer to this problem is doctors, physicians helping people get off narcotics if that's not what that is appropriate for them, and get in treatment and ultimately be rehabilitated.
All right, David Bier with the Cato Institute. Thank you for joining us.
Of course, anytime.